Hi everyone, my name's Rand Butcher. I'm the CEO of the Australian College of Critical Care Nurses. I just wanted to share with you a bit of an update of what we're doing at the Australian College of Critical Care Nurses. Our work is driven by the needs of critical care nurses and their membership. And one of the big things that's occurring now is that we just have a large influx of inexperienced nurses into the intensive care environment. And when it's great to get these new enthusiastic people come and work, it lifts everyone. It's exciting to have this enthusiasm, and it can often change a culture in intensive care. At the same time, it can be a challenging time. The experienced staff feel a bit of a burden. They feel responsibility to support these people. They've got to train them. They've got to coach them. They've got to supervise them. So adds a fair bit of stress. And I think times have changed a lot over the years. People are coming and going. So there's this constant churn of people coming into the intensive care or critical care unit, staying for a period of time, and then moving on. So you're constantly training and constantly upskilling people. At the same time, we have a large cohort of international nurses come that again add to the culture and bring a lot of experience from overseas that come into the unit. But they've got their own challenges. They've got to adjust to a new country and often a new way of practicing to that Australian standard. So as ACCCN's here to help you. We've got lots of resources available to you. There's a whole series called Scope, which are lectures from experienced experts around the world on intensive care and critical care practices. So I encourage you to take advantage of these. Many of our webinars are available. The existing ones we're going to make free for our members. So there's lots of resources there for people to come in and to use to try and help with this change in our intensive care workforce. And we look at our workforce, ACCCN is continuing to advocate for the critical care nurse. We're currently reviewing our intensive care nursing workforce standards. So these were last done in 2016. There's been a huge amount of literature since that time. So we've undergone a systematic review, and there's some really high quality literature highlighting the value of experienced, educated critical care nurses and how it impacts on outcome. So this new version has been written. It's going national stakeholder consultation. We're reviewing that feedback, and we've got health consumer feedback coming in as well. So hopefully that will be available soon to sort of outline the components of an intensive care environment that support that high quality level of care that we're used to in an Australian critical care environment. We're also working with our partners. We're working with the College of Intensive Care Medicine and ANZICS, and we're looking not only at the nursing workforce, but the entire workforce of an intensive care unit. So we're looking at nursing, medicine, allied health, and again, identifying what those features are of a well-functioning, good intensive care unit so that we can promote that and improve patient experience and patient outcome. So we're doing a lot in our intensive care world. We've also looking broader. We've got our annual scientific meeting that's coming up, and this year we're partnering with the World Federation of Pediatric Intensive and Critical Care Society. They have their World Congress. It's going to be in Melbourne, so we're hosting the two events together. And when we've got our annual scientific meeting and a World Congress together, we attract lots of great speakers. The trade bring in their international staff as well. So we've got a really good program. So I encourage you to attend. We'll be in Melbourne. There's also an unprecedented number of workshops. We've got 54 workshops, lots of content that should invigorate you and educate you. These workshops are open to anyone. You don't have to come to the World Congress to participate in them. You can just enroll in the workshop. Lots of them are high fidelity. We've got international teams coming. So this is a really exciting time, and there's lots of content to engage in. So I thank you for all your hard work. It's difficult. At the moment, it's exhausting, but you're doing a great job. But it's adds so much value, and the standard of critical care in Australia is such a high level, and it's the nurses and the staff that sort of promote that quality in critical care. So thank you very much.